Assalamu alaikum. So in the group, I shared pictures of a patient with fungal infection of the mouth and disseminated disease all over the body. Uh, and then it got cured, the tongue got cured within about 5 days. And the body itself got cured in about a month or so. He also had fungal toenail infections as well as in the armpits and the groin and on the legs. What you got to realize is fungal infection is an opportunistic infection most of the time. It comes in when the host defense system is down or niches are found because of some differences in food, allergies, or whatever the person might have. A lot of times you'll see this in people who have had transplants done. But nonetheless, in this case, that was not the condition. And I tried to get to the bottom of it, but it seemed like that there was some disturbance in the health when it came to diabetes. His HbA1c level was elevated, and hence the fungal infection got hold of the tongue and the mouth and the gums and throughout the body. Fungal infection, like I said, is an opportunistic infection, and particularly inside the mouth, it is there as long as the normal flora of the mouth is compromised and the normal quantities and the ratios of the bacteria, which are good bacteria, are not inside the mouth. So, in order to restore it, we need to do at least two things. Number one, we got to kill the fungus itself. And remember, the fungus itself makes spores, so it can come back and rebound, and it's a long lasting condition. This poor patient was on pain medication because he had pain as well, on and off, but he was on antifungals for almost 2 years and more. And imagine what kind of havoc it would lead on the liver and rest of the body and kidney function, particularly liver. Anyhow, to kill the fungal infection, the best thing I learned from my professor, who was a microbiologist back in California, was to use vinegar. Now, when we're talking about vinegar, don't think about the one that you can buy off the counter, the white one. That's not vinegar. That's only acid. What you want to get is fruit-based vinegar. And the best I've found is balsamic vinegar, Balsmic. Two countries make it wonderfully. Number one country is Spain, and the other one is Italy. So you have to have balsamic vinegar from either Italy or Spain. Go to a good store and try to find that. It is brownish in color and very tasty. It is sweet actually. And if you add it to your salads, the salad dressing would be delicious. It does not burn your tongue or your mouth. So I had him take a tablespoonful of it 3 times a day, put it inside the mouth, and hold it and swish it around the mouth as long as he could 1, 2, 3 minutes. And after that, he could just swallow it. As he was swallowing it, I thought that it would also clear off the esophagus and go down to the stomach. Stomach acid would kill the fungal infection regardless, but esophagus itself would be a storage for the fungus that can be regurgitated into the mouth and cause a fungal infection. He was instructed to use the same on a little swab, cotton pellet, or like 2 by 2 gauze piece of simple cotton, or the ones that women use to clean up their nails of the nail polish. And he would dab the balsamic vinegar and rub it all over his body and leave it there for 10 or 15 minutes, then wash it off by taking a shower. No special soap was used. Inside the mouth, he would swish it, hold it, and swallow it. And after that, he was supposed to sip on homemade yogurt drink all day long. One sip, hold it in the mouth, swallow it. Another sip, 5 minutes later, take it inside the mouth, swish it around, and swallow it. So, what we were trying to do is with balsamic vinegar, kill off the fungal infection and then repopulate the mouth with lactobacilli, the good bacteria that are found in yogurt. Now, remember, don't buy Nestle yogurt or one of those manufactured yogurts because they are basically gelatinous, they don't have live culture. So get the one that your mother or your father or your sister or somebody who makes it in the house, or you make it yourself, and make lassi out of it or a drink. And the patient is supposed to sip that all day long. And then you saw the difference within about 5 days. The oral condition was totally recovered, and it took about 3 weeks to a month, and the whole body was clean, and he had remained clean since then. So we do watch up on the patient.